1 minute to go. Yeah, Doc, we're about to go.
Okay.
Good evening, ladies and gentlemen. Joining us via multiple social media channels, Facebook, YouTube, and the Dr. Fundi channel. My name is Dr. Fundi Lenyati. Welcome to our channel. Our topic of discussion today, we are discussing COVID-19 pandemic in relation to children. I've covered a number of topics since the lockdown started, but one topic that we never covered was how does this pandemic affect children? So today we have a special guest, Dr. Lizzie Tabane, Elizabeth Nomakua. All right, Nomakua means, okay, no. let me not explain it. She'll explain it herself. You know, our parents, they used to give us names like, Nobelungu. So Nomakua is more like Nobelungu. But anyway,
Yes.
she is a qualified specialist pediatrician. She qualified as a medical doctor in 1995 from University of Natal Medical School. She then trained as a specialist in pediatrics, what we call a registrar, from 1999 to 2003. She then qualified as a specialist, pediatrician in 2003. Since then, she has played on a number of roles as a lecturer, as a private specialist, as a head of the ART program, for young people. She has just been, appointed the head of department for pediatrics, and child health at the Universitas Academic Hospital under the Medical School Faculty of Health Sciences at the University of Free State. Dr. Tabane, welcome to the Dr. Funde channel.
Thank you, Dr. Fundile. Thanks for your welcome and for the wonderful introduction. Yes, I'm Nomakua. It's a Ndebele name. I'm Mama Hoa, sort of name, Nobelungu, what the Zulus will call me. But I'm Nomakua Elizabeth Tabane.
Yes, I forgot to say, you're not just a specialist pediatrician. You are also a mother of two grown-up young men. Eh?
Yes, a mother of two.
Yes, and that means you are well protected. Well protected. Those guys will definitely make sure that mommy is looked after and is well protected. Now, Doc, thank you, man, for joining us today. We really want you to feel comfortable and just empower us with information on this topic about COVID-19 and the children. There hasn't been much focus, not just within this channel, but also out there. Everybody has been focusing on what happens to adults. But because of recent events, like the whole issue of kids having to go back to school on the 1st of June, there's so much anxiety with parents relating to this COVID-19 pandemic. And there's also a lot of news that have been, on the international channels like CNN, about some rare syndrome that is affecting kids. So I hope that then, you'll be able to just take us through, and hopefully by the end of our session, our viewers will actually be much more empowered. And you having been a lecturer before, I'm sure we will definitely be empowered. Now, Doc, if we just focus on this pandemic since it started late last year to date, how has it, affected children? Just give us a picture of how prevalent is this illness amongst children?
Yes, this pandemic, I don't know what to say. Fortunately, it hasn't shown to affect children very much. Based on the few publications and also the experiences from the other countries like China, Italy, USA, Germany, and United Kingdom, of all the people that were infected with coronavirus, about 2% of those are children. Are children less than the age of 19. And even those that are less than the age of 10 years, it has affected about 1% of the children. For example, now in South Africa, if we look at our figures, with for example, I'm not exactly sure of today, but if it's about 16,000 people infected South Africans infected with corona, about 300 or so are children,
Actually.
less than 19. But even if those children get infected with coronavirus, it has shown, even in other countries in the north, that they do not show severe disease like the adults or the much older people.
Now, I just want us to move nicely, Doc. I'm going to ask these questions. You're moving ahead of me a little bit.
Okay.
Yeah.
Okay.
So what you are saying is that children are as vulnerable as the adults in terms of getting infected. However, yes, but in terms of actual numbers or percentages, they form a small percentage. You're saying 2%, under 19s, and less than a percent for those who are under 10s. Yes. Why are we seeing that? Is there any particular reason why we are seeing such a small percentage of young people who are affected by COVID?
Actually, there's a lot of speculation why that children are not affected as much as adults do. Because they tend to be exposed to the same kind of risks as adults, but they tend to show less disease, or they tend to be less affected. The speculations are, but we know that especially the children that are going to school, that age group, they are generally healthy individuals, so they don't generally get sick, which is a trend that we see normally under normal circumstances. The other, then the speculations that because as we have seen with adults, especially the older adults, when they get COVID, they get very ill. And the reason they get ill is because the immune system, that when they recognizes the coronavirus, it reacts very badly and cause what we call severe inflammation. That's why those people, older people, get severe lung inflammatory disease, and some of them requiring ventilation. But the immune system of children is still developing, so it doesn't react so violently like the immune system of adults towards the coronavirus.
Yes. Okay.
There are several speculations about when the coronavirus gets into your body and into your cells, it uses what we call a coenzymes. It attaches itself to the cells using coenzymes like angiotensin converting. It's just technical things, but which are more available in adults than in children. So that's why the speculation, that's why that children are not very much affected like adults.
The ACE2 receptors.
The ACE2 receptors are more in adults, and especially older adults, than in children.
Oh, okay. Oh, yes. All right. Now tell me, Doc, so now we've established then that young people are generally not so much at risk of getting infected, yes, and you've shared the reasons. In terms of them presenting with COVID-19, is their presentation the same as what we would expect amongst adults, or maybe their presentation is actually different?
Generally, their presentation will be the same, similar to the same to adults. They can present with fever, sore throat, cough, running nose, shortness of breath, just like adults. But we've seen in smaller children where they can present with more diarrhea, also, or vomiting, without the respiratory symptoms. But generally, they present the same as adults.
All right. So again, I just want to consolidate this thing. So you're saying they generally present the same as adults. However, yes, at times, they may present differently by, yes, presenting more with gastrointestinal symptoms, yes, your diarrhea and everything, and less what everyone sees, on TV.
Yes, they
Yes,
can present atypically. We say
yes,
atypically, that not as other adults. They can present with headaches as well, but it's more or less the same as adults most of the time.
yes, 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 yes.
Yes.
Now, any particular reason for that?
We don't know. Even if they present, majority of them, even though they present with these symptoms, they are not usually sick like adults. We always say
Yes,
more than 90% of those children are either asymptomatic or have mild to moderate disease,
yes, yes.
majority of them. And
But
those
yeah,
who less than 10% do get severe disease that and makes them be admitted in hospital.
yeah, yeah, yeah. Okay. And as much as they are asymptomatic, largely, or they have a mild disease, are they infectious though?
Yes, they are infectious. That's why we really we are, when there's small children and elderly people in the same household, when the child, we always say, please, in this case, we say we protect the elderly from the kids, because these children, as they are not usually very ill, but they are infectious and they can infect the adults, especially the elderly.
Wow. Okay.
Yes.
That's a challenge then, because if they are not showing symptoms for most of the part, I mean, for most parts, they are not showing
Yes.
symptoms, and then they are carriers of the germ, then
Yes, they
clearly
are.
then that they become a risk to the older people.
Yes, they
Uh,
become a risk to the elderly. Yes.
Now, that brings me then to the point around the kids having to go back to school uh, on the first. Does that mean then that parents are actually justified in being anxious about kids going back? Because as much as they hear that kids are not so much affected, but then it means those kids are actually a potential risk to them.
Yes, but now we have to balance with what do we do with the academic year? Are we abandoning this year, or uh, their concern is really, it's fair, because the concern is not actually, we are not actually very much concerned about the children getting the COVID. We know that they can handle the COVID well, their bodies can handle the COVID well. Most of them don't get very ill, although they can infect others. Is the problem is when they bring the corona or the COVID home, and there's elderly or grandparents in the household, then they can infect the elderly grandparents or older parents.
Especially those who might have pre-existing health challenges.
Yes, especially those with pre-existing disease conditions as well.
So if you were then asked to go and have a 5 minutes with Mom Age, uh, about this, would you really encourage her to continue with the plan of the 1st of June return of the kids? Or would you say, you know what, maybe wait for the winter to pass before we can actually get these kids to go back there?
Me personally, as a pediatrician,
Yes,
winter
as a
season,
pediatrician.
me as a pediatrician, I know winter months are our peak, our busiest month of the year, with pneumonias, with the smaller kids, they have what we call RSV bronchiolitis. It's very busy, and we are now starting with our flu season. So I will advise our minister, can we just postpone until the winter is over? Maybe go back to school in August, September, because so that we can go through this winter and the flu season. Because even without COVID, it is a very bad season now we are approaching, because now it's COVID plus the flu season plus the pneumonia season plus the bronchiolitis season. For the pediatrician, it's a very tough season. Even though we know that children generally do not, older children generally do not get that sick. But we don't know now with the added burden of COVID on top of that.
All right. So clearly it means the anxiety amongst the parents is actually,
It's
real.
justified.
It's
Yes,
justified.
it's real.
All right. Now, if then the schools are saying, we've been told the kids must come back on the 1st, is there anything as a parent that I would need to do to try and mitigate the risk, not only of COVID-19, but other, you've mentioned bronchiolitis and different things that happen during winter. Is there anything, is there some vaccines? Is there some, how can I at least minimize the risk of my kids presenting with all of those things, if I'm a parent?
I think the general measures that we expect everybody to practice, we must teach our children hand washing, practice social distance, using masks when they are out or playing out. Also, I mean, when they go to school, even though we expect the school to provide sanitizers, I'll provide my own child with a small bottle of a sanitizer to keep in the bag, so that you encourage hand washing, using hand sanitizers, using your face mask, keeping a social distance. You make sure that you practice that even at home, and then you make sure that you teach your child to practice that even at school.
Yeah. Okay. And then that is more around COVID, prevention. Obviously, the way COVID is, is transmitted is similar to the other respiratory viruses. So if one adopts the measures that you've just mentioned, it will also cover the other respiratory germs.
It would also cover the others, yes.
Yes, but would you advise things like flu vaccines? You talked about RSV. There's some injectable immune booster for RSV. I just want to hear from you as as somebody who deals with kids every day.
Yes, unfortunately, the flu vaccines, unfortunately, we don't have flu vaccines for children less than 2 years old. But we always encourage children who have got comorbidities or coexisting conditions like heart diseases, who have diabetes or asthma, for them to get flu vaccines. Because the flu vaccine, even if it won't prevent you from getting COVID, but when you get COVID, the belief is that you won't get as ill as the person who did not have a flu vaccine. Because when you have a flu vaccine, at least you've built some immunity to against the virus, any virus that you might get. So flu vaccines, we encourage even the health workers in general to get flu vaccines, because they'll be exposed to people with COVID, with coronavirus infections. So if possible, get your children flu vaccines, get them immune boosters. The RSV bronchiolitis is very dangerous, especially for the small babies, especially those that were born prematurely. We always encourage them to get RSV bronchiolitis vaccine or immune booster, so that they don't get this bronchiolitis, because it can be dangerous to them. If they get that plus COVID, then it's even worse, because we have seen that children who generally present with COVID, they've got other co-infections, they've got other infections going on.
Yeah. Oh, okay. Then now, obviously, there is no treatment for COVID at this point. There's not even a vaccine for COVID at this point. So some people talk about, well, in any war, there's always two sides. In this particular war, there is COVID as a virus. There's no treatment, there's no vaccine. And then there's the immune system on the other side, which is supposed to help the body to fight off this thing. Is there anything that maybe parents can do to help their kids to strengthen their immune system as they have to go back to school? I'm thinking about immune boosters or anything like that. I know, some of them stay with grannies, and grannies will always have something to give. Some of those are good, some of those maybe are not so good. So I'm just talking.
Unfortunately, many of the so-called immune boosters, they are not clinically or trial or tested. So it is just, we just have to believe what the seller or the producer of whatever immune booster says it works. But generally speaking, it's just the immune boosters usually that I believe in as a pediatrician, and I advise my parents, the parents of the patients that I treat. It is just the child must just get healthy food. Eat healthy. Winter, we've got, if you consume more of the vitamin C producing or containing foods, like oranges, we talk about legumes or beans, and because those have natural immune boosters, that can prevent the children from getting ill from any other disease, even viral infections. But foods that contain vitamin C are very good with immune boosters. The natural food, not supplementing. There's obviously some supplements that have vitamin C that they are sold in pharmacies that you can procure. There are many. I grew up with one of them. I don't know if I can mention Scott's emulsion, that I was one of the children who grew up in Scott's emulsion, with Scott's emulsion, and I'm still healthy now, so maybe it worked. So, and it's still there out there. Vitamin C containing foods, especially food like beans, they are very good with proteins and vitamin C, and they can protect you from diseases. That's why we eat soup in winter.
Yes. Okay. Yes. All right, Doc. Now I now understand. Let's go back to this COVID-19 again. So we now know it doesn't really affect kids to that, it's a small percentage. And even if they do, it's a mild infection, self-limiting. Now, if we look at the recovery, those who do get infected, does it take the same period it would normally take with older people? I'm talking about that small percentage of kids who happen to have a much more severe type of illness.
Remarkably, the kids recover quicker than adults, less than 7 days. They fall, most of them asymptomatic. They recover very quickly from the disease as well. Majority of them, except those less than 1% who ends up in ICUs. There are those that can become severely ill and end up in ICU being ventilated, but it's also a very small percentage. And it's usually the very small ones, the ones that are less than 1 year old, and then these other ones who now present with some atypical presentation.
Oh, okay. Yesterday, I had an interview with Mr. Zwelinzima Vavi, who has just recovered from a COVID-19 infection.
Yes.
Now, he shared with us that in his household, it was him, his 7-year-old son, and his wife. And he says, it took him more than 3 weeks to actually shake off this infection. However, his son, who's about 7, within 7 days, he was cleared. Even the tests that were done, to look for the virus, they cleared him 7 days, from the time he was diagnosed. Whilst him, at 21 days, he was still, showing that he's not negative. So it goes with what you've just, shared now, that kids tend to recover sooner. Those who actually, whether they are having a mild illness or even a serious illness, they tend to recover sooner compared to, to the adults. Now, what about those kids who have got pre-existing health challenges? Again, I'm asking in the context of the return to school. If I've got a kid who's asthmatic, or a kid who's diabetic, or a kid who's got a rheumatic heart disease, or things like those, any precautions that the parents may need to, put in place as the kids have to go back to school?
Unfortunately, the children with pre-existing conditions are at risk, at higher risk than their peers, like those that you've mentioned, the diabetics, the asthmatics, and children with heart diseases and
HIV,
and cancer, children with TB. And we know that TB and HIV are still endemic in our country, even though also this age group that we are talking about, the older school-going age group, there's less of the HIV, but the TB is still very pandemic. So those children are also vulnerable from COVID. Here we just have to really take it to case by case. Do you keep your child at home and arrange with the school? Because not many of our parents can do homeschooling. I don't think I can. The curriculum has changed, or the syllabus has changed so much ever since we've been at school. So can we arrange with the schools, for example, maybe to tutor these children separately? Maybe at home or at school, try to also to increase their immune system, boost their immune system, but with natural food and supplements that you believe that they work, and try to keep them, it's winter, try to keep them warm.
Now, Doc, there's something else that has come up. The HSRC released a study sometime last month, which was looking at the social aspects of this pandemic. And one of the findings there was that people who've got, chronic illnesses, who are supposed to go for their checkups, for their meds, because of this COVID lockdown, they did not go and get their meds, and this week sometime, even the MEC of Health here in Gauteng, he also reported that a significant percentage of people who take ARVs missed their treatment in the past month or two. So if there is a parent who's got a kid with a pre-existing illness, who might have missed, checkups and things like those, what advice would you have for those people before, the kids go back to school?
I think there's been a misunderstanding or miscommunications, because as far as we know, the healthcare facilities or the clinics and the hospitals, they were never closed. Although especially the outpatients divisions of our clinics, in hospitals specifically, especially for those clinics that cater for those types of diseases, the diabetics, the chronic diseases, the services were decreased, but they could patients with emergencies or who need urgent assistance or who need to collect the medication, those services were still open. I will advise them, please contact your clinic or the nearest clinic or the hospital to get the treatment that is needed, because in reality of the situation is those clinics were never closed, or they were never supposed to be closed. The services were supposed to be open and but they have scaled down, where patients were said to be stable on treatment, they were given, like, for example, 3 months treatment. But if you feel that you're not well, or you are starting not to feel well, you could go back, you can go back to the clinic or to the hospital to get your medication. So parents, please, I advise them to take their children to the clinics for checkups, and especially if it's urgent. If you feel that your child is not well, don't take your child to school. Even before the COVID time, we always say children who are ill, parents are always advised from schools. If your child is ill, don't send your child to school. So it's always the case even now. If your child is ill, don't send your child to school. Rather seek help from the clinic, or to the hospital, or to the general practitioner. Don't just send a sick child to school. If they are on chronic treatment, please seek treatment for the child so that the condition doesn't get worse.
I think that's very good advice, Doc. I'm going to ask you a question that you can choose to answer it or not answer it, Doc. It was, it's a bit of a controversial question linked to the news today. The news that we saw this morning about our Minister of Health, who had written a long thing about Professor Glenda Gray, who's the head of the MRC. There were some articles that reported that Professor Gray had said there is an increase in kids who have got malnutrition, who are presenting to the public hospitals. And she was specific about Bara. And she was saying that is a consequence of the fact that there isn't focus on anything else that is not COVID-19. So the minister came out, and almost said she is not telling the truth about this supposed increase in kids with malnutrition. Now, I'm asking this question. I'm basically saying, with you being there at Universitas, hospital, have you guys observed any change in numbers in terms of kids who are presenting with issues of malnutrition? And I'm not asking you because I want you to prove or disprove anyone. I'm just asking it because it's something that is topical. Have you observed anything? Has the guys who are reporting to you, have they shared any trend that maybe it's starting to worry them around malnutrition or other illnesses that are common that they may feel are not being given due attention because we are focusing on COVID?
Yeah. To start with, the past few years, we had pockets of presentations where children will come with malnutrition, and it hasn't stopped. So it's been going and coming, now and then we'll see a child with a severe malnutrition that we get admitted. And but in our area, we know where they come from. We can certainly know that in the Free State, this type of children usually come from this type of areas. They come from the farms, they come from these other small holdings, and not generally. And I must say, we haven't seen an increase in the trend, but it's still being the same. Being the same, that we still get these children who come from these areas with malnutrition. And it's still been, in our case, it's been consistent. There hasn't been an increase, but we still see those children with malnutrition presenting in our facilities.
Yes, no, thank you, Doc, about that, because I think one was just trying to see what are you seeing in the Free State. Earlier today, the MEC of Health here in Gauteng was also asked about the same, and his view was, yes, there are cases of malnutrition, and these cases have been there, and there hasn't been any noticeable increase in the numbers, during this period. So he doesn't know where this information came from. And it's basically the same thing that you are also, sharing with us, that in the area of the Free State, in the hospital that you are in charge of, you have not really seen any dramatic change that would send some alarm bells around issues of malnutrition. Now, tell me, Doc, if a mother is COVID-19 positive, can she transmit that germ to her unborn baby? And if yes, are there any health issues that the child may present with?
Yes, there can be a transmission from a mother to a baby of COVID, just like there has been transmission of other viruses like chickenpox, like HIV. Even COVID has been shown in some studies, especially in Canada and the US, where babies born from COVID positive mothers, they were tested immediately. In those countries, especially in the US, they test the baby immediately. The baby get tested immediately with the swabs in the mouth and the nose. They tested the umbilical cords. They test even the amniotic fluids and all that. And it has shown, and they even biopsied the placenta. And it has shown that in some, not all babies, but in some babies born with mothers from COVID positive mothers, there has been shown that there is in utero transmission where the baby gets the virus from the mother. Yes, there has been instances like that. But most of those babies, if it's a full-term baby, most of them were asymptomatic. They didn't need to be admitted in hospital, and they were discharged home without any problems. But then there was a problem now with coming to premature babies. Those are the ones that become vulnerable because of severe immune system that is low, is a very low immune system. And also they've got also other added problems of immaturity. That's when those babies then presented with respiratory problems, and then they ended up in the ICU. But we haven't had, those, it's because of the coexisting or problems of immaturity that these babies might also be ill. Or if the mother had other conditions, like if the mother was also ill from other conditions other than COVID, diabetic mothers, HIV mothers, plus COVID, then they give birth to even sicker babies.
Yes. So, Doc, as we are talking about premature babies, just for the benefit of our viewers, what are the common issues that you guys normally see when the babies are born prematurely? I know you've touched already on issues on respiratory issues, but just to focus on that. Why I'm asking, because I want us to go back to the first case that was announced yesterday of a child who unfortunately passed away and who seemed to have had a respiratory challenge. So, but just in a normal kind of situation pre-COVID, a child who is born at 30 weeks, of pregnancy, what are the kind of issues that you guys normally see that normally worry you as a pediatrician, if that baby has to be delivered prematurely?
Yes, and usually prematurity, it's something that we really, really want to discourage. And we tend to see now, I don't know whether it's doctor indicated or patient indicated, where mothers want to deliver earlier. And we strongly, strongly discourage that as pediatricians, because even if the baby is born at 36 weeks, it's still very premature. If the baby is born at 37 weeks, it's still premature. So we encourage babies, please mothers, deliver at full term. If nature allows, go to full terms, preferably to 39 weeks. Problems of prematurity mostly these babies, there are reasons why sometimes they get born prematurely. It's usually when the mother is also having some coexisting problems, or when the mother has got some infection that leads to prematurity. If the mother has got hypertension, that can give rise to a baby with prematurity. If the mother has got HIV, can give birth to a baby prematurely. And the problems of premature babies, majority it's lungs. The lungs are immature, they have not been fully developed to can cope with the outside world. So the immaturity of lungs, those babies, then they struggle to breathe. We have to give them medications and put them on ventilators to mature the lungs, and so that they can breathe. The circulation, they tend to have problems of circulation, less blood, and they tend to have frequent infections because of the immune system is not mature. And these babies they can have brain bleeds, and they can develop they can develop hydrocephalus. They can have developed later on as they grow, even though they've survived the childhood. Then they go to school. Then we tend to see problems like of slow learners, children with autism. So prematurity really is not desirable. There's a lot of problems, but very early on, it's breathing problems, lung problems. They can have cardiac problems as well.
So if we then take that back to the reported first case of a death under 9 in the stats that were released yesterday by the National Department of Health, what we are told there is that both the mom and the kid tested positive for COVID.
Yes.
And we were also told that the kid could not breathe from the beginning and therefore was ventilated immediately. Yeah. And then we are also told that the kid then passed on. Now, obviously, we don't have the clinical notes of that patient to know was the death as a result of the COVID infection, or was the death most likely as a result of the immature lungs. Obviously, we don't have the case notes, but just from your experience as a pediatrician, what is the likely situation about that kid?
I don't know how far, how premature the baby was, but the most likely thing, especially if the baby presented even from after birth with struggling to breathe, the most likely cause is immaturity. It must be what we call the hyaline membrane disease, or now they call it the respiratory distress syndrome of the newborns. It's most likely is the cause of the baby's demise. Because, like I said, even when we see the presentation in adults, the elderly, those who demise, it's because when the immune system reacts against the virus, it reacts violently and causes severe inflammatory reactions, especially to the lungs. But these prematures don't have that immune system to fight off the virus. Yes, they have infection, but the immune system is inactive to fight off this virus. So that's why they cannot, it's unlikely for this baby to have developed this inflammatory response that these elderly people get, and that inflammatory response is the one that causes them to end up with a severe lung disease, and then they demise from it. So this baby, most likely, I think it was either a problem of prematurity due to maybe hyaline membrane disease, or a congenital infection, like a congenital, or the baby being born with pneumonia or such. But I don't believe it is the COVID itself that made the baby's condition to deteriorate and to demise.
All right. So now, let's say then a baby who is born of a mother who is COVID-19 positive.
Yes.
Remember, you guys as pediatrician, you encourage breastfeeding generally.
Yes.
I'm not talking about
Yes.
COVID patients. I'm talking about in general. We normally hear that breast is best, and there are all the positive reasons why breast is best. Now, in a situation where a mother is COVID-19 positive, would you guys advise those moms to breastfeed their kids, or would you say they should rather formula feed their kids?
We encourage breastfeeding even in COVID positive mothers. Breastfeeding is still best. There's very limited or very less transmission of the COVID through the breast milk. And we encourage mothers to still continue breastfeeding, but we have precautions for the mother to, when she's breastfeeding her baby, she must wear a mask so that she doesn't contaminate or expose the baby to her sputum or to saliva and all that. So she must wear a mask when she's breastfeeding her baby. And as far as when she finishes breastfeeding, we always say, if they're still in hospital, put the baby in an incubator, and they can only take the baby during feeding, so that we limit too much exposure of the baby to the mother who is positive. The mother must just take the baby during feeding, feed the baby, and put the baby maybe in an incubator or about more than a meter away from her. But breastfeeding is strongly encouraged.
So the same way that pediatricians were encouraging babies, to be breastfed, where the mothers were HIV positive.
Yes.
So it's basically nothing changed. It's the same approach. There's more benefits than the risks. Basically,
there is more benefits than the risks, unless the mother is ill, and then the mother is admitted in hospital and cannot feed. Then we can give the baby alternate feed or formula feeding. But if the mother is healthy enough to breastfeed, we encourage breastfeeding.
All right. Now, Doc, I think we've covered most of the things I thought are issues that are topical, stuff I've seen in social media from parents, issues that they were concerned about. But there was one more thing I would want you to just help us with. We, over the past 2 weeks, those people who watch international news, there's been a lot of coverage about a rare type of syndrome that is affecting kids who have got, COVID-19, especially in Europe and also in America. Have you read anything around that? What is that all about?
Yes, they talk about what we call a Kawasaki-like disease. It is it's COVID-related inflammatory disease that has been emerging, even though, and it causes severe disease, and the children end up in ICU, being ventilated in the ICU. But it's a very, very rare presentation that has not starting to emerge with children who are COVID positive. And also here, the immune system plays a role, and it's because now the virus triggers the immune system to overreact, and then then causes severe inflammatory reaction that affects the whole body, all the body systems, the heart a lot, the kidneys, the gut, the brain, because now mostly this type of a disease, or Kawasaki-like disease, it affects the blood vessels, the small blood vessels. They become bigger and they develop aneurysms and they can burst. So it is a catastrophic disease when it's severe, because it affects the whole body systems, especially the heart. And then the child then can demise or from the disease. But if it's caught very early on, then these children can do well because there's treatment for it. And this Kawasaki-like disease, the difference to other presentation now to children who get this COVID positive infections, these children, however, they get fever even longer. They develop red eyes. They've got develop abdominal pain, and they can also have abdominal distensions, and they can have the skin can be peeling, you know. Yes, so it is not a very a good disease, a nice disease to have, really, because it is an overreacting or aggressive immune system that usually affects the lungs, the heart especially, but it's because of the blood vessels and the way it presents like Kawasaki disease. That's why they call it a Kawasaki-like inflammatory disease that is triggered by the COVID virus. Because even the Kawasaki disease that we usually see, it's not like, because mostly it affects the heart, and and it's not congenital. You are not born with it. You know, it's those conditions that are also triggered by other viruses. Even before the COVID, the children who develop Kawasaki, they will present with some viral infection that triggers the inflammatory response that attacks the small blood vessels, cause dilatations of the blood vessels, and can results now with inflammation that causes the heart problems, the kidneys, the gut, and so on. So that is the imaging. They say it's the imaging.
It's an imaging. I mean, it's only been reported in the last few weeks. So I'm sure there's still a lot of new research that needs to come out. But I just wanted us to just briefly talk about it because there's a number of people who've already asked, to say, what about this thing? We're hearing this from CNN and Fox and whatever. But it has not been reported here in South Africa. I haven't heard anyone talking about something like that in the South African context. Even China, I did not hear much about it, but Europe and the US, I think that's where we are hearing the big numbers.
Yes, and as I've also alluded, even the Kawasaki before the coronavirus, it is a condition that was usually triggered by any viral infection. So it is not strange that even the COVID will trigger it to develop Kawasaki disease, because it's also a viral infection, and like the other condition previously, the Kawasaki's of previously were triggered by any viral infection. So, but we haven't seen, fortunately, in the country, we South African academics, we keep in touch, even though what is happening in the media out there, we also in the academic world, we keep in touch, and then we say, have you seen this? Please, we report to each other. Even if they say, do you have any babies that you've admitted? How many are sick? How many are in the ICU? So we keep in touch. So far, we haven't had anything in South Africa.
No, I think that's reassuring, Doc, because I think sometimes when we watch global or international news, we then forget that, what happens in those parts of the world does not necessarily mean it will happen here. I mean, one of the things I read around this was that you need to have seen so many cases to have one of these cases. So the reason why they are seeing in Europe and also in the US is because the caseload in those countries is abnormally high for them to see the few cases. So we are still at about around 16,000, 17,000. I can't remember where we are now as a country. So the numbers we have are very, very low compared to Italy, to Spain, to even Britain and the US. So maybe if we continue to contain this pandemic in South Africa, we may not even see the first case of that kind of multi-systemic inflammatory type of syndrome. All right, yes. Doc. So, but as we wrap up, Doc, is there anything that maybe we did not touch on that you think you would want to share with our viewers, that is related to COVID, or any health advice that you think it's important for children?
Yes, we following the statistics worldwide. Every day we look how many people are infected in the world and how many, and with the children as well, we track how many children have died. And out of almost 5 million people worldwide who have COVID, and almost out of 300,000 people have died from corona, there has been less than 10 as in number of children who have died from the disease. As much as it's not comforting, but it's very, very low numbers. And even those children who died, they had comorbidities. They were children with cancers, they were children with other problems with heart diseases who eventually demised. Like the baby that died in South Africa yesterday, related to COVID, it was a premature baby. So majority, in most cases, children do well, but unfortunately they're at risk. We hear parents say, I'm taking my child to be the grandmother. But in this winter, don't take your child to stay with the grandmother, because the child, especially when the schools open, the child now is going to infect grandmother, and grandmother's not going to do well. So parents must get alternatives now this winter season.
Yeah.
Yes.
Okay. No, then, Doc, I need to thank you for your time. I had asked for only 30 minutes, but we've actually taken double the time. So I want to apologize, but no, I think there was a lot we needed to talk about. So I want to thank you for availing your time to share information with our viewers. And I'm sure it's not the last time I talk to you. If there's something that has to do with kids again, I will come and knock at your door again and ask you to come and share with us, because I think the main purpose of having this platform is really to just ensure that there is ongoing awareness about various health issues, that especially those that are topical. And so you have been able to assist here today, and for that we are very, very grateful.
Thank you very much. I must say it was long overdue. Thank you very much, Dr.
All right, thank you very much, Doc. Greetings to those two young men. That you are looking after. They will always be kids, even if they are over 18.
Yes, now they're looking after me now.
Yes, all right. But anyway, goodbye, Doc, and thank you very much. I want to say goodbye to everyone who had joined us, via Facebook or YouTube or even the Dr. Fundi platform. We value your time. Thank you very much.